Hello, I'm Dr. Maury Markman from City of Hope, and today and in the next several segments of Minutes with Markman, I'd like to discuss the rarely discussed topic of the role of the physician versus the role of the clinical investigator, and specifically, of course, in these Minutes with Markman, the role of the oncologist versus the role of the clinical cancer investigator. Now, first, we start off by saying there's simply no question about the importance of clinical research in the development of modern medicine in general and in the evolution of cancer therapeutics, screening, and prevention strategies. We would simply be nowhere close to where we are in terms of the quality of care we can provide, the outcomes, without rigorous, well-defined clinical research. And my perspective includes the fact that there's an absolute need to continue to focus on first-class investigative efforts in the realm of cancer management, and this is not up for debate. But the topic that I'm going to highlight is relatively focused, but a critical component of this arena. The responsibility of an individual clinician to always, I repeat, always act in the best interests of her or his individual patient versus what might be required of that physician oncologist serving in the role as an individual study PI or investigator on a clinical trial, and how there might be a tension or actual direct conflict between these roles and how the clinician investigator should respond. Consider recently published words of Dr. Jerry Minikoff, well-known ethicist, who states, "The problem arises when researchers turn from the ethics of clinical care to the ethics of research. When a physician is conducting research, the goal becomes that of trying to answer a research question. In doing that, the physician's activities may no longer always be in the best interests of the research participants. Among the things that might take place in research that could conflict with the goal of only doing what is in the patient's best interests are randomizing participants to different treatment arms, failing to individualize treatments, requiring possibly risky tests whose results will not alter the participants' treatment, and failing to disclose interim results." There is much to discuss here, and particularly to emphasize this tension very realistically that can develop between that role of that clinician, same person, also the clinical investigator. More to come, and I thank you for your attention.